Good afternoon. I'm David Sweat, Deputy Director, Shelby County Health Department, and welcome to the City of Memphis, Shelby County COVID Task Force briefing for April 13th. We'll jump straight into the numbers, and as of today, we have 92,836 cases that have been reported in the pandemic so far. That's an increase of 111 new cases yesterday here in Shelby County. We had 1,585 deaths that have occurred so far, none in the last 24 hours, at least in terms of reports. In the surrounding area, in Tittman County, Tennessee, we have 7,184 cases that have been reported. In Fayette County, Tennessee, we've had 4,858 cases reported in the pandemic so far. DeSoto County in Mississippi, we've had 20,826 cases reported. And in Crittenden County, Arkansas, 5,551 cases have been reported so far. Now, we've had over 400,000 doses of vaccine administered in Shelby County, but there have been 276,603 people who have been vaccinated so far in the vaccine campaign, and that represents 29% of the population and 39% of our vaccine campaign goal. 116,154 of those people have received one shot of a two-dose series, and 160,449 Shelby County residents have received both doses of a two-dose series or one dose of Johnson & Johnson vaccine. So for more information about the vaccine campaign, I'm going to turn it over now to Chief Doug McGowen from the City of Memphis.
Thank you, David. I do have a few updates today. I'll talk a little bit about our vaccine progress, some operational changes to some of our pods. I'll talk a little bit about some unused doses that occurred the other night. And also we'll have a discussion about the impact of the J&J announcement that just was made public this morning. So first, on our progress, as David said, we have administered more than 435,000 vaccines. That means 276,000 plus people have received at least one dose of vaccine in Shelby County. More than 1,000 homebound and homeless individuals have received a vaccination. And we continue to expand our opportunities for folks to receive vaccine. Our partnerships with churches in the neighborhoods that are most underserved and have the lowest uptake continues, with more than 20 of those events scheduled in the next few weeks. And we have more than 90 private partners now who are administering the vaccine as we begin to normalize the process. So let me talk a little bit about operational changes. As you know, especially when we stood up the Community Vaccination Center at the Pipkin building, we have made a few changes there. We went to first and second doses. We opened the afternoons to no appointment necessary. So we're going to continue to make it as easy for people to get access to a vaccine as possible. And so tomorrow at the Pipkin building only, we will be announcing that it is, quote, wide open Wednesday. In other words, no appointment is necessary to go to the Pipkin building and get a vaccination tomorrow between 7 a.m. and 7 p.m. So at the Pipkin building, wide open Wednesday, 7 a.m. to 7 p.m. If you do have an appointment at the Pipkin building, that will be honored when you get to the site. We'll make sure you're ushered to the front of the line so that you can make your appointment that you took the time to schedule. Now, let me talk just a little bit about the topic of wasted doses. As you know, last week I spoke with you and there was a report about 1,000 or so wasted doses at the Pipkin site, and we corrected the record on that there were none last week. But I also said at the outset of this operation that I was the accountable person for every aspect of this operation. And so today I did want to talk in a little bit more detail about wasted doses and let you know that waste is a part of the process. Nationally, it's no less true here in Memphis and Shelby County. For the 435,000 plus doses that we've administered, since we have begun this operation through the public pods, less than 100 doses have been either unused or wasted since we began. And all of those have been reported on a daily basis to the Tennessee Department of Health and to the higher authorities who are the issuing authority for that vaccine. Now, more than half of those doses are attributable to vials that have been cracked or broken, either in transport or as they were being moved from case to case. About another 30 to 40% of those are as a result of what there was a lack of low dead space syringes. For the Pfizer vaccine, the federal government has said that we should extract 6 doses from every vial. Unless you have a low dead space syringe, you can only extract 5. Well, that one that you couldn't get out is called a wasted vaccine. And then the last reason is what I talked about last week. That is a dose that has been drawn into a vial and is unused at the end of the day. That occurred Saturday night at the Pipkin building, as we had 25 unused doses at the end of the day that are, quote, wasted. That is as a result, as you know, we shifted late last week to the first come, first serve model at the Pipkin building from 5 p.m. to 8 p.m. As we approached the end of the day, after administering almost 2,500 vaccines, our team overestimated the number of individuals who were coming through the line. As a result, we overdrew by about 70 vaccines. In other words, we ran out of clients and we had about 70 vaccines still to administer. So our team stayed at the Pipkin site until midnight trying to administer every one of those doses. They called upon the wait list that we have. We sent emails, social media blasts. We sent individuals to the universities that surround the fairground site. We sent people to Overton Square. We sent people downtown to several of the local establishments over in Cooper Young, and successfully got 45 people to come to the site and get vaccinated. But by midnight, we still had 25 doses that were unused, and therefore those are wasted. We discovered the error in the process in overestimation. We also corrected the process that allowed too many people to tell the pharmacist that they needed another dose. So all of those have been corrected. In the days following, we have had no other instances of that. But in fairness, I told you I'm accountable. I told you I would be the one that told you if that happened. And so that's what I'm doing here today to make sure that we all understand exactly what was going on with the process. So at the end of that day, it was very successful. More than 2,500 vaccinations delivered at the Pipkin site, and we continue to march on. The last update I'll give is on the subject of the Johnson & Johnson vaccine. There was an announcement this morning by the CDC that they are pausing administration of the Johnson & Johnson vaccine. And so, in like turn, the city of Memphis is pausing our administration of the Johnson & Johnson vaccine. Now, today there are only 2 operations that are affected by that. First, we had a community-based pod at one of our local churches, and you'll hear a little bit more about that. That pod is going on today. We simply substituted the Pfizer vaccine for the J&J vaccine. So there's no impact to the operation, just a different vaccination being delivered. The second operation is for homeless and homebound operations, and again, we have simply substituted the Pfizer vaccine for the J&J vaccine. A little tougher to handle, but it's the right thing to do so the operation can continue. To our knowledge, no one here in the local area has experienced any adverse effects from the J&J. No one at our community-based pods, homebound or homeless residents. And the suspension of the J&J vaccine will not impact in any meaningful way our operations here to continue delivering vaccinations for the city of Memphis. So we will provide more information as it becomes available. We do not know yet whether it is a single day, a multi-day, or a weeks-long pause. When we get that information, we will let you know. So I'll stop there, and I'm going to turn it over to Mr. Mauricio Calvo, who is with Latino Memphis, to give us a quick update. Mauricio?
Thank you, Doug. Well, good afternoon. Buenas tardes. You ready to do this in English and Spanish? Well, we'll see. So I'll make my remarks in both languages. There are a lot of things that we do not know about the vaccine. Hay muchas cosas que no sabemos sobre la vacuna. What we do know is that the alternative is fatal. Lo que sí sabemos es que no hacer nada al respecto es fatal y nos quita la vida. So our community has lost thousands of people. And not only that, we know all the consequences. We know that we have lost jobs. We know that our businesses have closed. Our children have not been able to go to school. Lo que sí sabemos es que hemos cerrado negocios, hemos perdido trabajos y nuestros hijos no pueden ir a la escuela. So what are we going to do about it? I mean, the best shot that we have literally is to take this vaccine. Así que lo que podemos hacer al respecto, la mejor opción que tenemos es ponernos la vacuna. No hay vuelta de hoja. A little bit of hesitation, a little bit of questions, I mean, that's normal. But simply we cannot afford the option of not doing it. Hay muchas razones por las cuales uno puede tener preguntas o dudas y eso hasta cierto punto es normal. Lo que no podemos hacer es darnos el lujo de no hacer nada al respecto. Today, the city of Memphis and the health department have done everything they can. I have witnessed that to eliminate every possible barrier for people to get the vaccine. Yo he sido testigo de que hoy el Departamento de Salud y la ciudad de Memphis han hecho todo, hasta lo imposible, para eliminar cualquier barrera que impida que alguien se ponga la vacuna. So we have to take advantage of that opportunity, because other communities are not as fortunate as we are. And we can see that by the numbers of people making lines, people having appointments canceled. That is not happening here. In fact, we just heard Chief McGowen saying tomorrow we have open Wednesday. Anybody without an appointment can show up between the hours of 7 a.m. and 7 p.m. at the Pipkin building. If you do have an appointment, they will honor that, but if you don't have one, you can still show up. Acabamos de escuchar hoy que a partir de mañana, por ejemplo, el miércoles habrá vacunas de las 7 de la mañana a las 7 de la noche, sin cita, sin preguntas, nada. Llegas, te pones la vacuna. Today also, the Church of the Ascension has vaccines until 6 p.m., and there are, as of this morning, 700 spots left. El centro de la Iglesia de la Ascensión tiene vacunas disponibles el día de hoy, y hasta hace rato todavía 700 vacunas disponibles. So what are we going to do about it? Right? So we have to take advantage of this opportunity. Lo que tenemos que hacer es tomar ventaja de esta oportunidad. If you don't want to do it because you have fears or concerns, do it for somebody that you love. Si tú no estás convencido, hazlo por alguien que quieres. At Latino Memphis, we're now offering assistance for people who do want to make an appointment. So you can call us and check us on Facebook, and we'll help you make an appointment. There are other options for people, and the fire department offers people, homebound people to get vaccinated at their homes, and there are many other alternatives. También en Latino Memphis estamos ofreciendo asistencia en la que tú nos llamas y nosotros te ayudamos a sacar tu cita si eso es lo que tú prefieres. También si tú no puedes salir de tu casa, el departamento de bomberos viene a tu casa a ponerte la vacuna. So now we know. All the options are available. Let's take advantage of this. Let's get rid of this horrible thing that has caused so many pain and so much loss in our communities, and let's get vaccinated. Así que ya sabemos lo que tenemos que hacer. Ataquemos este enemigo que nos ha costado tantas vidas, nos ha costado trabajo y la educación de nuestros hijos. Vacunémonos para todos. Gracias. Thank you. Sorry, I'll turn it to Dr. Randolph from the health department. Thank you.
Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the health officer for Shelby County Health Department. Just want to highlight a few things, and then we'll open it up for questions. As you well know, it is approaching time for us to issue a new health directive. We try to do that every 2 to 4 weeks, and so therefore we will issue health directive number 20 this week, and just want to give you a few heads up as it relates to the health directive. One is that we will be opening up buffets with some restrictions, such as having hand sanitizing stations located away from the food, but encouraging customers to wash hands and sanitize hands before serving themselves at the buffet. We also intend to make some changes that relates to music and dancing, and more will be said about that. And we're encouraging, of course, the vaccinations and encouraging people to get vaccinated. In the health directive, we will address the issue of the upcoming evictions and some of the requirements that leasers must meet in terms of providing notification to their tenants and ensuring that they have access to information as it relates to resources that's available. And so those are the other thing that I want to just make you aware of as citizens. As you know, our numbers overall are still declining, though there is some indication that past few days, there's been some leveling off, a slight increase. We're monitoring that, but we've made progress. One of the things is that if we do not experience a surge in the next 30 days, we will be making some other adjustments to the health directive. One is placing more responsibility on you as individuals. I think we have provided ample amount of information as it relates to the measures, preventive measures that you as an individual should make and should incorporate and apply with, such as wearing the face mask, maintaining social distancing, washing your hands, sanitizing your hands, cleaning, avoiding poorly ventilated, crowded indoor settings. So with that said, a great emphasis will be placed on individual responsibility, and we will be moving more towards highly recommended guidance versus mandatory requirements. But more to come on that, and a lot of that would depend on what our numbers look like in the next 30 days. With that, I will stop and entertain any questions you may have.
Brad Broders, Local 24.
Thanks. I don't know who can take this first question, but is there a rough idea so far how many people roughly have had the Johnson & Johnson vaccine administered locally? And to those who had the shot, I know that you said there's been no adverse effects with anyone locally, but for anyone who might have concerns today, what would be your message to the public? And I have a follow-up.
Okay. I will let Mr. McGowen speak to the actual numbers, but my message to those who have received the vaccine, Johnson & Johnson, we're still learning. More information we are waiting to receive from the CDC and FDA. If you have received Johnson & Johnson beyond 3 weeks, you're probably in the clear. If you're having symptoms such as severe headaches, leg pain, shortness of breath, et cetera, follow up with your doctor for further assessment. We are concerned, but not worried at this point. Keep in mind that we're talking about 6 cases out of almost 7 million doses that have been given throughout the country. But again, there's more information that we're seeking before we can make a solid recommendation or guidance on that. I'll let Chief McGowan.
Brad, I can't give you the exact number, but it's several thousand. As you know, we had done some of our community-based pods, some of our homeless and homebound individuals, and we also did that at our fixed site pods. We had rotated that around, so my best estimate is 2,000 to 3,000. I do know in our inventory today that we have in stock 17,000 doses of J&J, and we have those segregated and set aside with labels that say do not use, and so they're kept in a separate location. So that's the best number, but I'll try to get you a more accurate number.
Sure, Doug, and while I have you up there for my follow-up, I know we went from 31.6 weekly doses, 31,600 to about 35.3 2 weeks ago to the last week. What's just been your overall takeaway with the demand and supply so far, especially at the Pipkin site now that it's fully open, and any updates on potential outreaches that you had mentioned last week?
Yeah, sure. So it is a little bit of an uptick. We've been as high as 38,000, 39,000 when we had a lot of community-based pods. We hit the Easter holiday, and so we're still coming off some of that averages being influenced by the days that we were not as open while we were getting the community-based vaccination site open at the Pipkin building. I am hopeful that more people will take advantage of this. As I said, we were trying to break down, I think Mauricio said it really well, breaking down every barrier for folks coming to get the vaccine. So we're willing to try new things. We opened up the afternoons for no appointments this week. We'll open up tomorrow all day. We are doing significant outreach to the community, both through our partners in the clergy. We're doing outreach into the community, various numbers of different communities through a number of trusted individuals in those communities through different communications methods, whether it be on social media, word of mouth, getting out there with street teams to talk to individuals. So, we even incentivize people to come down and get a vaccine at the Pipkin building with a MemPop, one of our great local companies, and we had about 750 take us up on that. So we thought there'd be a mad rush to get a MemPop on a beautiful day, but we're going to continue to looking for ideas. If it's successful tomorrow, we may actually look to expanding the Wide Open Wednesday to the rest of the week, but we'll take a look at the data tomorrow and see if we get some uptake. I'm hopeful that we will. We have 3,000, the ability to do at least 3,000 people there, and if more people show up, we have the capacity to do more.
Kelly Roberts, WMC.
Good afternoon. My first question is about J&J. I know a lot of people have been kind of waiting for the J&J, wanting to kind of hold off and just do that single dose. Are you concerned about if taking J&J out of the game right now could slow down any future vaccinations within the public of Shelby County?
Well, I think there's two parts to that, Kelly, and the first I'll talk about just the supply chain. We have a significant amount of Pfizer available. We can get Moderna as well. So I'm not worried about the supply of vaccine slowing us down whatsoever. We have lots of vaccine on hand. We can get more if we need it. So it's just a function of the 1 dose versus the 2 dose. I am concerned on the second point of anything that throws up another barrier to people taking a vaccine. So whether it's misinformation, whether it's a fear of needles that someone has, whether it is now the report that we have today, a pause while they evaluate treatments for any potential side effects, any barrier that causes people to have one more reason not to get a vaccine is concerning to me. So we are trying to break down as many of those barriers as possible. As you know, lots of our work has been getting people like you and others to say, I got mine, won't you come and get yours? And I think this is just one of those things that unnecessarily gets in the way. Yes, go ahead, David. Sure.
So Kelly, I'd like to build on that for a minute and just remind people that actually this recommended pause by the FDA and the CDC is an example of the system working the way it's designed to work. They did not issue a warning. They issued a recommendation to pause. But the reason they did that is because whenever someone gets a vaccination, part of what you walk away with from the experience are instructions on how you could report any adverse event or any side effects that you may be experiencing. And so that information is provided to you when you get vaccinated. And then as people have reported some of these events, the data's come in and the regulatory officials at FDA and the epidemiologists at the Centers for Disease Control said, okay, let's take a look at this data. And they recommended a pause so the Committee on Immunization Practices could evaluate the data and make a recommendation to the rest of us. But that is the safeguard built into the system to detect any problems if they are there. And before you can determine whether there is a problem, you have to have something to evaluate. And that's where we're at today. The Committee on Immunization Practice is evaluating data that's been reported from people who have experienced vaccination. So it's actually an example of the system working as it's designed to work.
Thank you so much. And my second question, I believe, Dr. Randolph, this would be for you. When you talk about, when you're keeping your eye on the 30-day, whether a case surge happens or not, and if it doesn't, that more responsibility would be put on the individual, would that mean discussing getting rid of the mask mandate?
We're currently looking at all of our mandates. And so the mask mandate is something that we would consider. Actually, the mask is the simplest tool that we have that's shown to be most effective and we would have to really have good reasons to get rid of it. But we'll reevaluate all of our measures to be able to match them with what the data is suggesting.
Dominique Dillon, Fox 13.
Hi, Dr. Randolph. You also mentioned that you noticed a slight increase. Could you share what you believe may be causing this increase? Do you think it's Easter, or are less people getting tested, making the positivity rate a little higher?
Well, well, it could be a combination of that. It also, as you well know, that we do have B117 in our community, which is a little more transmissible than the original virus that we're dealing with. And so ours just simply could be, if you notice our data, some days we have increases in cases and other days decreased. And so we're just looking, when we look over a 7-day period, we see that there is increase compared to the prior 7 days. And we're monitoring that to see if there's a particular trend. I think it's a little too early to say that that we're beginning the early stages of any type of spike, but we're watching it.
Thank you. That's all.
You're welcome.
Sam Hardiman, Commercial Appeal.
Doug, my first question is for you, and then I have a question for Dr. Randolph. Doug, how is the city going to change now that Pfizer is going to be at the community pop-up pods? How is the city going to change to make sure that people that are getting their first shot now come back and are reached for their second shot?
Well, the process won't change from what we do in any of our community pods, Sam. We just announce to the individuals what vaccine is available to them. They'll be provided their immunization card. They'll be given information about the earliest date at which they can come back, and then they will be asked to return. Now, we have, with our community-based pods, we will schedule another pod with that agency, that church, 3 weeks or 4 weeks hence, subject to the availability of the facility. And people will just be apprised that they need to come back for their second shot. We have seen a really good return rate. I think if you evaluate the data, I went back about a week, we had 19,000 first doses administered and 19,000 second doses administered of the last tranche of vaccines I looked at. So we're not really having a compliance issue as we were worried about a few weeks ago.
Okay. And my question for Dr. Randolph is, Dr. Randolph, you've used the language a few times describing it as less big, the health directives as less big brother and putting more responsibility on the individual. I would just ask you, sir, when have the health directives that the health department has issued not put more responsibility on the individual?
Well, I'm not saying that it has not placed more responsibility, but as you well know, we impose some restrictions that some would view as being, should I say, severe, such as the stay at home. Some would even consider the mask mandate to be an overreach or severe, or et cetera. And we must understand that in the early days of this pandemic, when we were not fully knowledgeable of what we were dealing with, and numbers were increasing, we instituted the typical public health measures to try to control the transmission of this virus. As we learn more, and we now understand what measures are effective, such as wearing the mask. If you remember in the early days, there was some debate on whether or not the mask is beneficial or not. As we learned more about social distancing and some of the other things, then we realized that when you think about it, wearing a mask, maintaining social distancing, avoiding crowded facilities, especially indoor with poor ventilation, washing your hands, sanitizing your hands, cleaning and disinfecting. These are behaviors that the individual must implement and must abide by and adhere to. And so at some point, it's our position that the government once have made it very clear that what citizens and individuals should do then should move from a requirement to recommendation, move from must to should. And so we're looking at that. And if our data continues to support that transition, that's the direction I feel we need to go.
We are out of time. Are there any closing messages today?
The closing message that I have is that, once again, let's hold the course. Let's continue to do these things that have gotten us where we are. Get vaccinated. Do not allow this setback that with Johnson & Johnson to deter you from getting vaccinated. We need to get vaccinated. We're going to find out more information about Johnson & Johnson. But we know Pfizer, we got Moderna. Get vaccinated. Continue to wear your mask. Continue to maintain social distancing so we can move on to better days. And I'll see if anyone else. No. So I wanted to just thank all of you for your attention and encourage you to let's keep the faith. Let's keep moving forward. We're making progress, and we're going to get there.